muffled, so I'm trying to catch what you're saying in that, in that big room. But anyway, I think you tossed the ball to me, right, Karen? Okay. So welcome everybody. This is our meeting of the Long-Term Care Committee, and I think today we've organized, or Karen has put together a presentation about COFA and what you do, and a little bit more information for all of us out in the community. And then Karen's going to talk, or I'll talk a little bit about the home health aide recognition event coming up later this month. And this month is National Home Care Week, so we're celebrating here at VNS. And there's, all home care agencies across the country are celebrating for the month, what we do in home care and enabling patients to stay at home, in their own home while they're recovering. So with that, Karen, should I pass it back to you, or do you want me to pass it to Lisa?
Lisa is okay with passing that along. And I think I'll wait till after Dawn and Andrea go to talk about the home health aide recognition, if that's okay. Sure. Give us a little more time to make sure we can all. Dawn, if you can hear me and Andrea, I think it'd be okay to get you guys started on your presentation. I don't think Sue Ellen can hear me.
It's very muffled. I'm having a hard time picking up some of it. I don't know if everybody else is having that problem, but
I can hear you guys
Karen. Fine. It's just you guys keep muting every once in a while, so it kind of sounds like you're cutting out, but when you do speak, I'm hearing you fine. I don't know if others are.
Okay. Hi, everyone. Andrea Davis here at the Office for the Aging. I'm going to go ahead and share my screen. Right. Okay. And we will go ahead and get started.
Okay. Can you, there we go. All right. Everyone can see the slide okay?
Yeah. Yeah, it's good.
Okay. Okay. So thank you for letting us present about Office for the Aging. Andrea and I are going to go over the services that we have together for our office. The Office for the Aging mission is to assist older adults and persons with long-term care needs to live independently in their homes and communities with quality of life and dignity, right? And so we're going to go ahead and get started. In this slide, you can see there are 4 covers of our resource booklets, which are updated regularly, and they're also on our website. And so they have a lot of services and information in them. There's one for falls prevention. We have housing for seniors, which includes senior housing, market rate housing for seniors, and long-term care facilities. And we have long-term support services, which has a lot of in-home support information in it, and then a lot of other services and resources for caregivers. So they're great booklets because they do have a lot of information in them, and we have them in the office. And like I said, you can also access them on the website. All right, so these are some of the directly provided services of our office. And there's quite a few of them, and we're going to go over each of them independently. So we're going to start with our New York Connects information and referral and counseling. So New York Connects an Office for the Aging. It's how the community gets information regarding all the services for older adults and persons with long-term care needs. And we do this by a person-centered approach, which means that, we are in tune with where the person is in their life, what they're looking for, what their wishes are, and what they need. And so we help to navigate the community resources and options based on their specific needs, and then we refer them to the appropriate programs or services. And we help guide people through the various processes of getting that assistance and getting information on subject per specific request. We get a lot of, as aging services specialists, we get a lot of requests from people asking for all kinds of information, legal information, advanced care planning, housing, transportation. So we look at all of that, and anything that they're asking for, we try to find some kind of resource for them.
All right. So in our office, we also have personal emergency response systems. We work with Doyle Medical Monitoring. They supply us with the units, they do the billing, and they respond to any calls that come in on these units. In our office, we go out and install them. We troubleshoot any issues that the client is having with them. And what it looks like is they just plug it into the wall, they wear a pendant around their neck, and if they have a fall or a medical emergency, they just press their button. Within 60 to 90 seconds, they're able to speak with the responder at Doyle that can send help to their location, whether it's home or on the go. The prices start at $25 and up, and they go up depending on the type of device that they get and what capability it has. We also do health insurance information, counseling, and assistance. So what that looks like is we have in our office 3 aging services specialists, myself and Dawn, and our coworker Amy, that are certified in HICAP to work with clients with their questions or enrollment in Medicare. We do help with some issues with Medicaid. And then there's some assistance programs like the Medicare Savings Program, Extra Help, that we can assist clients with. We also work with Lifelong. They do have a HICAP program at their agency as well, volunteers that are certified to do health insurance counseling. And it's an open enrollment currently, so we're all making appointments and taking walk-ins to do health insurance counseling.
Okay, in our agency, in our lobby, we have a caregiver resource center. So you can see in the pictures, there's a lot of books and pamphlets. So that is all related to caregivers, and caregivers can come and sign out materials, like some of the books on specific information they're looking for, and take it with them and use it until they're done, and then they just return it. So that's our lending library. Amy Jackson, who's our caregiver coordinator, does a newsletter, and people can sign up for that on our website. She also does a caregiver support group and trainings and workshops that are offered. We do caregiver counseling and focus on resources to assist with caregiving. And we have some respite care through caregiving. It's limited, but it helps to give the caregiver a break. And Amy and Andrea and I are all certified to teach a 6-week Powerful Tools for Caregivers course. And that course is geared towards caregivers themselves and how to take care of themselves, and you make time for themselves, and tons of information to help them be better caregivers and have the supports that they need. So Project Care Friendly Visiting Program is a program that I currently do. It's a friendly visiting program, and it's free to anyone in Tompkins County age 60 and over. It is to help alleviate loneliness, social isolation, and it can be done in their home with weekly friendly visiting. Or if people don't want someone in their home, we can also do it virtual, such as Zoom. And if some people only want a weekly visit by phone, or if they're ill, we can, change from in-home to a phone visit so they still have some connection. And these programs also help for caregivers to give them a short break, to leave and go do something for themselves or run errands, whatever. Project Generations is a part of Project Care, but the volunteers are all undergraduate students from Cornell and University and Ithaca College. So it's more of a generational experience between the participant and the volunteer, where Project Care basically is volunteers in the Tompkins County community that want to assist with helping our people that are socially isolated or lonely and so they provide a great service.
Okay, so another program, the Home Energy Assistance Program. This program actually opened today. So usually it opens around the beginning of November and goes throughout to the next year, usually closing in March or April of the following year. For this program, it is income based on the client's income. So they do have to be income eligible and responsible for heating their home. And with the Home Energy Assistance Program, they get a one-time benefit that supplements their heating costs for the winter. And under this program, they can get their heating equipment cleaned and tuned and repaired or replaced if needed. So this is something that we process applications for in our office, and we work closely with Department of Social Services to help clients who need the program access the program. All right, so another program or service of our office falls home safety assessments and aging in place evaluations. Both are at no cost to the client, and what that looks like is staff from our office come and make a home visit. We have a checklist, and we look through to see if there's any fall risks that are in the home or ways that they can make their home more accessible so that they can age in place. And we share this with the client as well as resources that they can reach out to, like INHS, which is Ithaca Neighborhood Housing Services, Finger Lakes Independence Center, where they can get home and safety modifications or repairs or assistive equipment. Another program, Senior Farmers Market Nutrition Program, that usually runs, I want to say, between June and July, and ends around September. And what that looks like is we get booklets from the state that those who are 60 and up and within the income guidelines can use. It's a $25 coupon booklet that they can use on fresh, unprocessed fruits and vegetables. These clients can get this benefit once a year, and they can use it at participating farmers markets that are across New York State. We also have Gadabout transportation tickets. Clients 60 and up in Tompkins County can receive up to 10 tickets each 12-month period. They can get zone 1 or 2 or a combination, and we can mail these out or they can pick them up. For clients that are interested in using Gadabout, it can be for medical appointments, going shopping, visiting a friend. They just need to call during business hours and give a 2-day notice so that they can get the ride that they need.
So we also have a ISEP program, which is the Extended In-Home Services for Elderly program. And this program provides those non-Medicaid services and supports to people for older adults who need help with daily activities such as dressing, bathing, personal care, shopping, and cooking. And this funding, and we also have unmet needs funding that is used to support this program. COFA also currently has positions for 2 part-time PCAs, each at 20 hours a week, to help serve our in-home care clients and make sure that they're getting service. The long-term care ombudsman program is out of our office, and it has a certified ombudsman and volunteers, and our certified ombudsman and advocates for residents of long-term care communities, such as assisted living, family type homes, and skilled nursing facilities. And our trained staff and volunteers protect patients and residents' rights through weekly facility visits, resident complaint investigations, and they provide education and resources to facility staff, residents, and family members. This is a free and confidential service, and it's aimed to ensure that all residents are treated with dignity and respect while they receive the highest possible quality of care of life. And our ombudsman program is in Region 12, and Region 12 consists of Tompkins, Chemung, and Schuyler counties. So our ombudsman, they visit all 3 counties on a regular basis. They visit the long-term care facilities and talk to people and make sure that their voice is being heard and their rights are being met.
All right, so we have these two programs that kind of work to combat social isolation and loneliness. We have companion pets in our office. There are some eligibility guidelines, and they are at no cost to the client, but you can contribute to the program, but it's not mandatory. The purpose of these companion pets is for those who may have some cognitive issues, they're experiencing social isolation or loneliness. They may not be able to take care of an animal. They may have just lost a loved animal. So we do have cats and dogs and birds, and the birds are actually called walker squawkers. And the idea there is that you put it on the walker, and if the client gets up without their walker, the bird starts squawking at it to remind the client to keep the walker with them. We also have LEQ units, and it's a voice-operated digital care companion. It's very proactive. As long as the client has internet, patience, and is able to work with technology. This is a device that is proactive and prompts the client throughout the day, suggesting different activities. And the client can put in medication reminders, appointment reminders, contacts of loved ones so that they can stay connected via their LEQ unit. And the LEQ, like I said, games, guided tours, but the idea is that this is a companion to combat social isolation. And this is also a program that's funded through New York State Office for the Aging. So the ones that we have available in our office are at no cost to the client. We also have intergenerational board games, and this is the company Joy for All. They also have the companion pets that we have in our office. They created some games, and the idea is to allow multi-generational play, engage peers, and facilitate that type of companionship and involvement with both parties. We have them in our office, and they're also available at Lifelong. We do have parking passes as well that clients can pick up at our office, buy them as they're needed. And we have them in 15, 20-minute, hour and a half, 2-hour increments. And all the client needs to do once they have them is just scratch off the date, time that they're parking and put it on their dashboard, so they don't have to worry about, they don't want to use the app or the lollipops that are still up around the city. And we also have a yard work and snow shoveling list. We do kind of look for volunteers, those who are willing to do work in Tompkins County for various jobs. Mostly a lot of yard work and snow shoveling, but we do have some people that do certain odd and end jobs on a paid or volunteer basis. And we do share that with any interested client that is just looking for some help with yard work, snow shoveling, whatever the case may be, and we'll give them that information as well. Great.
Okay, so now we're going to go over our contracted services of our office. So we contract with several different agencies, and Food Net Meals on Wheels is our senior nutrition program, congregate and home delivered meals, and nutrition counseling and education. We partner with Lifelong from the Senior Circle newsletter, the Mosaic program, the health insurance counseling, the Aging Mastery program, tax program, bingo size, and virtual senior center. The Tompkins County Long-Term Care Services provide case management and the expanded in-home services for the elderly program, the ISEP program, and caregiver respite. Ithaca Neighborhood Housing Services, we provide health and safety related home repairs for income eligible seniors. Finger Lakes Independent Center, they have the registry program, and they link individuals needing in-home assistance with independent persons for hire. We do referrals to Legal Assistance of Western New York or Law New York to provide legal assistance in civil matters to our clients. The Human Services Coalition as the coordination of the Long-Term Care Committee. Personal care and chores or housekeeping assistance are provided by the following agencies: Caregivers, Home Instead, and Finger Lakes Independent Center consumer directed program. All right, and I just want to say that we also do quite a bit of outreach in the community so that we can let people in the community know what services we provide. And we try to stay up to date on programs and resources to make sure that we're serving our clients. And our newsletters, the Senior Circle newsletter, the COFA newsletter, and the Caregiver newsletter, you can sign up for all of those on our website if you're interested. Okay. And this is our information about our agency, our Facebook page. Please join our Facebook page, and how to contact us. And our office hours are from 8:30 to 4:30, Monday through Friday. So thank you. Any questions?
Thank you so much. I'm gonna wait for other people to have questions because I always have them.
Okay.
Other people ask.
It's Lisa Monroe. There's a question in the chat. Can you share some information about the number of people utilizing the services you described? Sure. It's a really broad question. We have a statewide database that we put all our information in, so we do keep statistics on every single program. I'm not sure if you wanted to know specifically a program or just in general how many people we serve each year. There's duplicated clients, there's unduplicated clients. Just trying to get a better idea of what kind of numbers you're looking for would help me answer that better, I think.
I appreciate that. I was curious about some of the long-term care ombudsman work, the ISIP program. But if there's a place where I can go and look at that, so that I can inform the assembly member about numbers, that would be helpful. Is that a database that you just referenced?
Yeah, the database isn't for the public to see
It's not
necessarily,
a public, okay.
but we can share that information with you. I'd be happy to do that.
Okay,
The ombudsman program is kind of an outlier from our regular database because there's kind of a firewall, even though we're the host agency that holds the ombudsman program here. They have a separate database, so I can talk to them about, we can get an idea of how many clients that are in all the facilities, how many facilities they visit, and how many active cases that they've addressed, and we can get you that information. ISEP, off the top of my head, we have about 80 clients currently, probably about 25 clients on the waiting list, waiting for services for multiple reasons. It could be lack of aides, it could be lack of funding, which is usually the case. But again, we can email you some more specifics, and please feel free to share. Yes, thank you.
thank you. One quick clarifying question around the ISIP program. I thought I heard mentioned that the county hires public care attendants
Yes,
directly, that you employ 2 part-time.
correct.
Okay. I noted that there are about 14 or so counties around the state that are moving to the model of hiring people directly, which is a really interesting model. And I know something that the state, I just watched a presentation by Greg Olson at NYSOFA talking about ISIP, actually at a public hearing that the assembly held recently on that topic, and talking about that being really an ideal model to try to duplicate in other counties. So I've been trying to figure out some of the counties that are doing that direct hire of personal care attendants, which is just terrific, because obviously then they are county employees and all of the benefits that are attached to that. I would assume, even if they're part-time, correct?
Yes, and with benefits, they have access to vehicles. Transportation is a big issue for some home care aides. Yeah, it's a great model. It's a cost effective.
Mhm.
A lot of Medicaid dollars keeping people in their homes. So yeah, it is really good. We started about probably, I think it was 2022 that we started. We hired our first part-time aide, and now in 2024 we're hiring our second. So yeah, it's
Thank
working.
you.
And I think the continuity of care is the biggest plus of it, you know, where we have a huddle every week with the aides, with the case managers, with us, and it's just, I think the clients are really better served that way, so I'm glad you know
Thank
about it. Thank you.
Yeah, thank you for sharing that information. I'm actually very interested in the whole area of long-term care, as is the assembly member. So I know that, you know, we've been trying to follow and keep track of what's going on. And by the way, if anyone is interested in looking at that public hearing recording, it is on the Assembly's website, nyassembly.gov. Anna doesn't serve on the committee that hosted that particular public hearing. It was Assemblymember Ron Kim who chairs the Aging Committee, but Mr. Olson's testimony is very interesting to watch. Step by eye.
Thank you.
Sharon, this is Karen Brown, and I do the long-term care committee coordination, but I'd like to talk to you as Karen Brown, a personal community member right now. Just sometimes I don't like having the dual membership, but my mother is a client who Terry McCann, the organization, has made a huge difference in her life and has made a difference in my life. And just from the personal aspect of it, I'd like to do a shout out to say that without it, she lives in Titus Towers, might not still be there. And so their intervention and their care, along with the one that I didn't hear about, but maybe is I'm gonna get it wrong, the go-go grandparent or the transportation. Not only did it make a big difference in my mom's ability when she came home to be able to do outpatient stuff going to the hospital, but I've heard her friends talking about their utilizing it, and they were going on and on and on about how wonderful it was. So I just wanted to say that sometimes, you know, we get caught up in our personal or our professional hats and we say, oh, these things sound great to put them in. But I wanted to take a moment to thank the Office of Aging and Terry and the aides that come in and see her, and just say from a personal side of it, it's and as somebody who lives in Tompkins County, I'd like the assembly member to know that it is an amazing service, and that we don't have enough aides in the area, and we don't have enough to be able to meet the need. And so thank you for being aware of it and asking questions, because I can't say enough about how it's impacted both my mother's life and mine, being able to give me a little sanity to get away from her. A little bit, because I need that a little bit.
Yeah.
So as a caregiver who's at their wit's end, it has been a lifesaver. So thanks for it.
Thank you for sharing that. I appreciate it. And I'll definitely share that feedback. Thank you guys for letting me take a few minutes and ask those questions. I appreciate it.
But since Karen's brought up the go-go grandparents, I might as well talk about it a little bit. So we didn't have it in this presentation. It's still a new program for us. So we're kind of feeling our way through the weeds. And so it's not something we've advertised really broadly. We've started using the pilot with our case managed clients in the ISAP program. We've kind of started to expand out a little bit, but basically it's something that COFA gave every county, the New York State Office for the Aging gave every county a subsidy of basically a pot of money to use to provide rides. We decided here locally, we'd start using them for medical appointments, even out of county medical appointments, because that's always been a huge gap in, you know, if they've had a provider that's a specialist in Syracuse or Rochester, we're now how to get them there. So this week, we started using it that way. It's evolving, so we haven't really got it down to a science where we're like, oh yeah, we do this program and we do it well. It's working. Basically, the idea behind it is that it's like an Uber or Lyft based program that people can call for a ride. We register them, so the money is taken out of our subsidy. The tip is included in it. The client doesn't have to do anything. the Uber driver has to have a 4-star rating or above, and they have additional training on how to assist older people, whether it be walkers, canes, helping people in and out of cars, things like that. So those, you know, when you call the number and you're registered as one of our clients, they can, you'll get the ride to wherever you go. It's basically a one trip ride to wherever you need. So, yeah, and it's great that your mom was able to use it. It was an important appointment she had to go to, and you know, I think that's the key of it right there, is that, you know, that's what we want to serve. Hopefully we'll get more funding in the future. That's another reason why it's not real broad yet, because we don't know if it's gonna continue to be funded or not. We hope it is. But yeah, so that's just a little bit more about that, but that's an exciting.
It is, and you know, it's really interesting because unfortunately, my mother's situation like brought up everything that we talk about here. So she went in the hospital, and when she was going to be discharged the second time around, she was going to have visiting nurse services, which was going to be phenomenal. And then it ended up that because she needed to have a certain procedure with her port needed to be cleaned every day, and I wasn't able to get there. Long story. That then was going to mean that she needed to go to the infusion lab, which was a daily trip. Which then the problem with Gadabout is that they don't run on the weekend for if you're not in a certain, she didn't qualify for that. And so we kept running into all of these issues, is that she couldn't go to the infusion lab on the weekend with Gadabout. That's where Terry's assistance really was vital. She stepped in and was able to kind of bridge these gaps that we're assisting, because Cayuga, the hospital was doing a nice job as far as trying to connect to the resources, but they didn't know that like Gadabout didn't go on the weekend if she wasn't disabled and some different things. And so having Terry be like a consistent who knew my mom and knew me and some different things, was able to make the connection. But I have to say that had I not had my connections or information that I had, I fear that she may have, other people may have fallen through like the gaps, so to speak. So these programs are essential to what we're doing. Like here we are talking about long-term care and how do we help people between, and I think today, to me, this is just so important to have somebody from the assembly member's office here hearing this, having somebody from Cayuga Medical, having the county, having all these people talking about, it's one thing to have all of these programs, but how do we make sure that we're connecting and getting all the information to all the people that need to know how to use it? But I just can't say enough that like, it's amazing that we have these programs. And I think it's really important that we work together of how to make sure that everybody connects and knows about the programs so that people don't fall through the cracks, because it worked, but it was a lot of like connecting and stuff, but I cannot, anyways, it's just amazing to see the people here, and I didn't want to make it about me, but I did think it was important
It's great
to
example.
share that. The one thing I found too that I would just share is that it's very complicated. And that it's not, even though we sit in the meetings and we talk about it, navigating through all the systems and the insurance. The other thing is that navigating through the different handoffs between providers. And then knowing what insurance will and will not cover was an amazing like roller coaster. One person thought they should go to rehab, another provider says no, then the insurance weighs it, you know what I'm saying? So it is not as simple as A plus B plus C equals D. There's a lot of moving pieces, and we're just lucky to have some of the programs that we have, and I think I'm really happy that Dawn and Andrea wanted to talk about these programs so that people, not only those of us that are here know more about it, but people have been reaching out about wanting to listen to the meetings afterwards and things like that. So anyways, it's great. I just wanted to say thank you. Thank you.
Amy, Andrea, and I also do presentations. So like to senior groups, Rotary clubs, professional people. So we try to get out the information as much as we can besides just tabling and events and stuff. So anytime somebody wants a presentation, they could contact our office.
I was just, Don, that's a really good point. I would love to have the presentation for our staff that are out in the field, you know, working with patients so that they know the resources and some things that they could talk to the patients about.
Well, so Ellen, I would love to come to VNS and do
Okay. All right. Well, we do our staff meetings every other week on Wednesday morning. Maybe we
Okay.
could set you up for, we have our meeting planned for next week, but possibly the following 2 weeks on Wednesday morning. I can email you, Dawn.
Go ahead and email me, and yep, I can certainly do that.
That would be great. This would
Sure.
be really nice information for our staff to have to be able to pass it to the patients, you know, you know, so that they know what's available to them. And you know, I wanted to tell you that that was a really great presentation. You know, it was very informative, very organized, and it was just a really nice presentation. So thank you for that.
Thank you.
Are there,
Yeah, go ahead.
say, are there any of the programs that you think that we could help at the long-term care committee, or as, you know, we have folks from different organizations that could help you promote those, or ones that you know that are not being utilized as much that you think, gosh, if somebody just knew more about this one?
Question. I think, you know, just sharing information as we put it out. I mean, Karen's really our public information officer. She's the one that coordinates most of our outgoing stuff, you know, so
Yeah.
if we're sharing it with you, you as providers out there sharing it too, I think is key, you know, for a lot of it. Most of our programs are utilized to the level that they can be, especially it's usually the lack of funding that's the problem, you know, I mean, and when we talk about ISEP a lot, which is an amazing program to keep people in their homes, and, you know, it doesn't see a 1/10% of what Medicaid dollars
Yeah.
gives, you know?
Yeah.
But once you're in that program, you know, people are able to stay in their homes where they wanna be. They have a case manager that opens them up to all the other programs that are available to them because they know. They're here, they're working on it, they see it every day, so, not just programs, but other funding, particularly, you know, we have ancillary funding that we have a percentage of, which Brittany knows, you know, a lot of our funding is subscribed to certain percentages that we have to use it for certain things. So, you know, we can provide some wraparound things in people's homes too to help them, which transportation is one of them, food is another one, you know, all those kinds of things that we can help people with. So, you know, I don't even know why I just went off on that tangent, but
I have another idea. There is a with the CUCA health systems, they have monthly meetings with the physicians, so primary care physicians, well, all physicians in our area. I think like the presentation that you just gave would be very valuable for the physicians' offices to be aware of. And I can reach out to see about coordinating that. It's the person that's in charge is Dr. Elizabeth Smith, and I can reach out to her if you want me to see if we could organize a presentation to the physicians.
that'd be great, that'd be awesome.
Okay, I'll be glad to do that.
I'd also like to plug, I know it's not a COFA program, but our community health advocate program at Human Service Coalition. I know Karen Brown had mentioned the difficulties of navigating health insurance and what it does and does not cover. And that's exactly what the community health advocate program is for. And it works for any type of insurance, Medicare, Medicaid, private, you know, employer. It also does dabble in some, assistance with Medicare. I just helped someone with their enrollment the other day through our CHOP program here. And another plug I wanted to put as well, which hopefully everyone here is aware of, but a lot of these services you can get connected through 211. So if you're unsure of the services in our area, that's always a good resource just to call and ask, and they should help put you in touch with those resources.
Thanks, Nicole. I actually contact 211 sometimes when people ask me for something and I'm not sure and everybody's been so helpful in that
Yes,
program.
it's great. You can chat, you can email, you can call, whatever works for you. And there's also on our website, you can search the database too for programs as well.
Anybody else have any questions about the COFA presentation? Okay, Karen Brown, it's back to you.
You did a fantastic job. I think you need a job at like the
News channel.
news channel. I feel like I should be at the forecast, like where the great part is, since we've been having these member highlights, we've had people come up and like actually volunteer to be like, can we be next? Can we do this? So thank you, Dawn and Andrea, for wanting to make sure that everybody had that information. And if any other time you want to pop in, I can do back to you and you can present on anything, that'd be great. Next month, we do have for the tough stuff conversation, we have another member who's going to present on their services. It'll be the Open Doors program that is from Southern Tier Independence Center and Matthew Lee. We'll have a flyer that'll go out, but the more that we can have folks get in front, I think the better we can be informed when we're out, because the best advocates, I think, are ourselves as we're talking. And one of the things too that I think, Sue Ellen, that you just sparked a comment, like kind of something for me to think about and to think along the lines of the long-term care committee is, are there like organizations that we need to be talking about? How do we get this information on as part of onboarding? So like I'm gonna put it about myself. I guess I kind of do that a lot. I don't like to, but like, the case manager who worked with us as a social worker was fantastic, but was new and was learning, do you know what I mean? So it makes me think back to our age-friendly conversations. And is there something we could be doing around either the 4Ms or something along with, how can we help with onboarding of new folks in the health profession, in the community organizations that are getting the information that Karen's done such a great job. I mean, I also wanted to say kudos to your marketing stuff. It looks beautiful with all the logos and the stuff. It looks great. But like, how do we help, get that out to people, as we've talked about with the caregiving and things along those lines? A lot of times people don't even realize they need it until they're in the midst of it. So maybe what can we put our thinking caps on for next year? How can we actually maybe look at how can we be
Karen, with that thought, we have we designed an orientation program for all of our staff, and it's an online learning format. Something like the presentation that you just gave, if we put that on included that as part of our orientation, we could get that information out, to any of our staff when we're orienting them, and then they would, have it when they're out caring for patients. And maybe other organizations could do the same thing, like caregivers. And who else was there? Flick. Your presentation was so concise, and simple to follow, but provided a lot of information. Even that presentation is part of agency's orientation, I think would go a long way with, the thought that you're having on how to get this information out to others.
Right, yeah. I thought that might be an interesting subcommittee to look at of putting together like kind of an onboarding resource type thing for
Yeah.
community-based folks, just to know what's available.
Mhm. Even with the nursing program, TC3, we have a board member who's an instructor there. I could talk with them about even, including something like the presentation in their program, their training program for their nurses. So that, when, even when they're being trained, they understand the importance of knowing resources that are available to, people in our community. I think there's different ways, if we really think through it, of how we can get this information out, to the people that need it. I think it's nice to say that you have the website, but a lot of people, unless, like, let's say the nursing program or like our orientation, you can say you have the website, but then people won't go out and look at it. So if you include more information, and in that information, show them the website, but give them more information, um, so that they have it readily available, because I think they just won't go out and hit the website. Am I saying that the right way?
I think the video you guys did too, your mission. I think we're in the world of YouTube. Of like people get like a 2-minute thing.
I'm not sharing that video anywhere.
I've been like putting it out there. But
I mean, it's good information, I'll do it for that, but.
no, but something similar. I know we don't like ourselves, or that kind of thing, but watching it, I thought it was a
Yeah.
nice job of talking about the mission and
And,
stuff.
and that's, kudos to our county, public information, and communications director. I mean, they've been trying to do that for every county department. I think we're the first guinea pig to do that. And yeah, I mean, and it is a good way, you're right?
To kind of drive it, so like kind of like what Sue Ellen's talking about, to keep it relevant too.
Yeah.
We had something that's short, small, whatever, because things change all the time. But if that person like was like, oh, I saw that, I should go to the webpage then they're gonna be driven to something that will have the most up-to-date programs and things on it versus, sometimes things can get out of date kind of quickly, but this might be a good project to take a look at, just split it off onto if we want to.
Well, if you do something like that, say in our office, I do a lot of constituent work and, I'm constantly giving people resources. So, one of the reasons I'm here is to sort of gain more information about what's available. So I often disperse information. So if I had a link, because just yesterday I was going through some website and sort of taking stuff out because I just knew the person I was sending it to wasn't gonna be able to click, it was a New York State website, but go through all, it's not that easy sometimes,
Especially when you're in crisis or you need
Yeah.
something quickly,
Yeah.
Try to like switch through. Sure. I mean to take over Sue Ellen, but I think Dawn did it. She said back to me. We should never do that, Dawn. Otherwise I'll just talk forever. Back to you, Sue Ellen.
It's back to me. Okay. So we want to, Karen, you want to just talk about the home health aid event?
Yeah.
And I didn't pull the information. I don't have the date right in front of me. It is
13th.
Oh, she can't, I don't know why.
It's November 13th. And it is from 4 to 6 p.m. And I may have Nicole talk a little more than me because I've been an absentee person. And so I'm gonna have to fess up to not being very available lately. So Nicole has had to take on the burden of a whole lot of stuff, but do you mind updating us on where we're at with that, Nicole?
Not a problem, not a problem. So yes, November 13th at Foundation of Light, from 4 to 6. I think right now, hopefully, maybe people are just not RSVPing. I think we have roughly a little under between 25 and 30 with guests. And we're well situated to like handle like up to 100. So we certainly want to get the word out. I know we've reached out to different, organizations that employ and ask them to, share the RSVP. But if within your networks you have connections or, people maybe not employed by agencies, please spread the word about it. I'm going to put a link for the RSVP. I'm going to put a few links. So first I'm going to put the RSVP link. So this is to share for anyone who would like to share to RSVP. Then the other thing is if anyone is interested in coming and attending and helping, please also RSVP. And then if you'd like to help with any of like the setup, duties during the event or afterwards, I also have another link if you'd like to sign up for that. So that will be the second link. This is to sign up to help with the event. And then finally, I also have a link. We've had a lot of generous support from community organizations. We've had some sponsors provide just funds to help shop, food donations, raffle items, a lot of great support. But if you or anyone you know wants to provide any kind of in-kind support, even like one of the things that we're still trying to work through is like gift bags. So items for gift bags would be great. So if like your organization has, giveaways, or you just want to provide some sort of financial support, we also have a link for that as well. So and then in that link, you could indicate what type of support you'd like to provide. So that is the final one that I will.
And Nicole, did the Cuca Medical Center let you know that they're going to provide media coverage?
They did not tell me that. No, I know they're providing sponsorship for support.
Yeah, I think they're also going to have somebody there
Okay.
to do pictures and do some a publication about the event.
Wonderful. Well, that's news to me. So I'm glad to hear that. But yeah, so yeah, we've had a lot of great people come together and put support. We have Tim Dean is going to be our speaker for the event. I'm going to provide some presentation that will, qualify for continuing education credits for those who are interested around, like compassion fatigue and self-care. So he will be giving that presentation. And yeah, some great raffles and giveaways. So, and then we'll have some like nice hors d'oeuvres and desserts and beverages. So yeah, please spread the word.
Hey, Nicole,
Mm-hmm.
I just wanted to also show that we will send those links out as well as a follow-up with the recording of this and of the other things. But also, I just wanted to put out that if you yourself know of a home health aide that's doing a fantastic job, they may not think of themselves to like sign up and to go. But since this event does allow them to bring a guest, if you want to like offer to bring them, that would be a great way to sign up and to show them that they are really being recognized. Feel free to do that as well. Or at least tell them you'd like to sign them up. If they want to bring somebody else, they can, but feel free to bring them along to, or if you know a family that's really benefiting from a home health aide and they want to show their thanks in a way, that would be a great way as a family member to invite them to bring them.
Yes, and just to be clear, we have promoted this to include home health aides and personal care assistants. So anyone that fills those roles.
Thank you, Nicole, for stepping in.
No problem.
Yes. Back to you.
Is it, do we have other things on the agenda?
If anyone else has any updates on any events that they're doing or things along those lines, this is a good time to be able to do a shout out about things that are coming up. not, then the rest of the time could be used for bringing up any topics or trends or things that are pertinent to long-term care in Tompkins County. And if not, we have the gift of 15 minutes, but we do have 15 minutes that if, you know, one of the things that was said in the survey around the long-term care committee needs is wanting the ability to hear what's going on, talk about some different trends or things. So if anybody wants to have that dialogue, this is an opportunity for it.
I'll just say that I think we in this office are kind of very great this time of the year, as Andrea said, today opens HEAP. And it's open enrollment for health, you know, Medicare, health insurance counseling. So that's what our staff's doing. And we don't usually plan a lot of big events at this time of the year or anything because everybody's involved with those programs. So just to kind of give you an idea of what we're up to.
So if we don't have anything else, should we close out the meeting?
Yeah, I think that would probably be okay to. I think you're okay. If anyone else has anything else, otherwise we're say sayonara. And it you on December 5th for the discussion around how to help folks who are in long-term care be able to access home and community services. See you then on the 5th.
Right? Bye, everybody.
Everyone.
Okay. Thank you, everybody.
Thank you.
Bye.